Good afternoon, everyone. This is Kyle Caldwell with the Council of Michigan Foundations. Welcome. We're glad you're here. I am happy and delighted to host this conversation. Michigan Responds, our United Charitable Sector Talks, Needs and Next Steps amid COVID-19. The Council of Michigan Foundations is proud to host, along with our partners. The Council of Michigan Foundation is the nation's regional philanthropy serving organization with more than 300 members, serving 85% of all endowed charitable assets in Michigan. For nearly 50 years, CMF has been working to grow the impact of Michigan philanthropy, working with donors, volunteers, nonprofit leaders in our business and government sectors to help us all achieve vibrant communities with great opportunities for all. This is an unprecedented time, and not only are we facing the extraordinary challenges, but we're also doing the work in physically isolated conditions. Today's conversations is about connection. For important reasons of safety and health in the wake of the COVID-19 pandemic, we're far apart. But in many ways, this crisis is ensuring that we're working more closely together, more than ever, to support communities across the state. Funders, nonprofits, United Ways, volunteers, sector partners, we're all collaborating in new and creative ways to support our communities and each other. We're excited to have registered well over 350 participants on this call. I'm going to ask Andrea Judd Sherver to share a few key notes regarding today's program and how we'll manage the Q&A, and then we'll get started. So Andrea, I'm going to turn it over to you for some housekeeping items.
Thanks, Kyle, and good afternoon, everyone. As Kyle mentioned, we do have a tremendous number of participants on the webinar, and we're so pleased to have each one of you here. In order to reduce background noise during the call, we will be keeping all participant lines muted throughout the webinar. However, we do have a couple different ways that you can engage with us. In the chat box, which you'll find in the webinar controls on your screen, it will either be at the top or the bottom. You will find links to content and web pages referenced throughout the webinar. Bridget McGuigan will be posting those out, so look for chat posts from her. If you have any questions about technical difficulties or audio levels, please use this box to send a note directly to me, listed as CMF Webinars host account, and I'll get those handled for you as best as I can. If you do have questions for the panelists, we ask that you please use the Q&A function found in that same spot with your webinar controls, either at the top or bottom of your screen. We'll be watching for those throughout the webinar, and we'll be feeding them to the panelists as they arise or at the end during our Q&A session. Please note we will get to as many questions as we are able. With that, I'll turn it back over to you, Kyle.
Thank you, Andrea. I'm honored to welcome on this call a group of really dynamic, highly collaborative, and deeply thoughtful and innovative leaders from across our charitable sector. We are all in the role of intermediaries, and intermediaries bring together diverse communities and interest and collaborations. We also know that in this fast moving time and overlapping commitments and overlapping members, that there's a tension. Oftentimes, infrastructure organizations can find ways to be highly collaborative, excuse me, but also these are times where we could end up overlapping resources, bumping into each other's work. And we thought that it would be really helpful for our sector to understand how all of us have been getting together throughout this crisis. Throughout the last several weeks, we've been working in close partnership to coordinate our efforts. We're excited for this opportunity to bring our networks together for a conversation on what we're seeing and hearing across the sector now, and consider what we're seeing and hearing in the weeks and the months ahead. We'll also explore the inequities that we've seen at the center of the pandemic. Some of that existed prior, and some of it is going to be further exacerbated as this health and financial crisis continues. I'd like now to introduce my colleagues who are joining me today. First off, we have Dr. Teri Behrens, who is the Executive Director of the Dorothy A. Johnson Center for Philanthropy at Grand Valley State University. She's also the founding editor-in-chief of the Foundation Review. The Johnson Center was established in 1992 as an academic center within the College of Community and Public Service at Grand Valley State University. The center offers original research, expertise on the latest theories in the field, as well as professional development services, courses, trainings, and philanthropic tools to support effective philanthropy, strong nonprofits, and informed community change. Also joining us is Ginna Holmes, who's the Executive Director of the Michigan Community Service Commission, a role that she has served in under 2 administrations, both the Snyder and now the Whitmer administration. The Community Service Commission was established in '91 through the Michigan Office of the Governor as the state's leading agency for volunteerism. Alongside federal efforts, the commission and its community partners have engaged tens of thousands of volunteers of all ages, supported hundreds of community-based projects, and leveraged millions of dollars for education, the environment, veteran services, health, housing foreclosure, and disaster response. We're also joined by Mike Larson. Mike is the president and CEO of the Michigan Association of United Ways and a veteran leader in the Michigan Network of United Ways, having led one of the state's largest United Ways in Kalamazoo, as well as Battle Creek. Since 1947, the Michigan Association of United Ways has worked with United Ways across the state to help improve performance, reduce costs, and have greater impact. The Michigan Association of United Ways is a partner in developing powerful responses to the current and emerging issues in local communities and provides leadership in policy influence and capacity building. We're also joined by Donna Murray-Brown, who's the president and CEO of the Michigan Nonprofit Association. I should note, also a former banker, and her skill sets today are more important than ever. She was a former banker where she was working with some of the state's largest nonprofits and funders, and now comes to M&A as its leader. M&A was incorporated in 1990, connects and supports more than 900 member nonprofit organizations, including all nonprofit organizations and governmental entities, as well as business and consultants that serve them. We're so lucky to have this great network of leaders in Michigan to join all of you, fellow leaders and champions in our sector. Now let's get started. So we're going to start our conversation with what are we seeing and hearing in the current trends in communities and nonprofits. I'm going to invite Donna to kick off the conversation. Donna, can you talk to us a little bit about what nonprofits are hearing and doing and sharing your insights on the current needs?
Sure, thank you, Kyle. Actually, if I had to think about what's happening now as it relates to nonprofits and what they're hearing and what they need, and what they've been sharing with me directly has been advice, guidance, and capital. Those seem to be the things that they need. And advice is really around this uncertainty around what should they do as it relates to maybe planned events that they had in the future. They might be in June or September or even in December, and deciding whether or not in this new uncertain reality, should they continue with those things. Many of those things are fundraisers that get to the capital piece of it. And so they're trying to discern, how do they make up for that capital? How can they actually begin to think about doing something digitally when they weren't really necessarily prepared for that? And then many of the things that they're thinking about right now really need guidance in terms of legal guidance and guidance from their CPA, because many of these decisions are multifaceted in terms of the impact that they have. So this has been a dynamic situation that they find themselves in. However, there's been rays of hope where the foundation community has been able to provide flexibility as it relates to capital that they've received through grants. So that's a good thing, and they're working through that. Certainly, they've been asking questions around, like, what can they do to amass more capital? And that's when the stimulus package seemed to come out just at the right time, when there was a need of relief. But then there was also complications in terms of understanding the language, understanding something that wasn't necessarily designed for nonprofits, and how can they navigate through an application process that's very different than they've been accustomed to, and then the process being uneven in terms of how they could apply at financial institutions that were either only serving their existing customers, or how to be able to obtain in particular, the Paychex Protection Program. How could they obtain that, and what does it look like? And is it really the best decision for their organization moving forward? So there have been a myriad of things that have taken place here. And one other thing I also want to bring up is this notion around working remotely, which seems relatively easy for, you might think, many organizations, but some organizations weren't ever equipped for that. They were finding that they didn't have the necessary tools to be able to provide their employees to do that. And then even if they did, then there was a need sometimes for their employees to get more broadband services, to expand their internet services or expand their cellular services to be able to accommodate the demand that they were experiencing by working from home. And who pays for that when you have lack of resources? So there are a myriad of things that are taking place right now, but again, categorizing them, it would be really around just providing sound advice through times of uncertainty and really guiding them through a process that's very complicated, like the PPP program. And then of course, getting capital at a time when they're seeing shrinking budgets and really uncertain about how they'll be able to amass resources in the future.
Thank you, Donna. Thank you for also, earlier today, I know you hosted a webinar to try to help your members and all of our nonprofit community understand the challenges in the banking system and with the PPP loans. And so I want to thank you for your leadership there. Mike, I want to turn to you and talk a little bit about United Way and what you're hearing from your members and the communities they serve on the ground. And can you talk to us a little bit about some of the data that you all are collecting and what that tells us about responses and needs when it comes to COVID-19?
All right, thanks, Kyle. We've got local United Ways all over the state of Michigan, partnering with Michigan 211 and our 7 regional 211 centers, trying to connect people to those critical services that they're facing. And one of the very significant values, other than connecting people to where they can get help with 211, is the data, the real-time data that helps inform us. And just to highlight some of those top needs as of yesterday, and many of these will not surprise you. Number 1 was food pantries, 2 was rent payment assistance, 3 was disease and disability information, 4 electric service payment assistance, and 5 unemployment insurance. They also are capturing those top unmet needs. And this is where we have challenges, where we've got to find ways to fill the gaps. And the number 1 right now is rent payment assistance. 2 would be VITA program sites, the tax preparation piece, electric service payment assistance, grocery and ordering and delivery to especially those at-risk populations, 5 homeless and motel vouchers to round off the top 5. I think it's critical as we think how we respond as the nonprofit sector is we have to be very intentional about utilizing data to help us inform as we respond to the immediate, but we know we've got long-term issues that we're going to need to address. So I think I'd really encourage us how we use data to help support that and inform that work. The other piece I'd like to highlight too in this is Michigan 211 has just created a 211 COVID-19 dashboard. And you'll see that. You also have access to that. That can really help you dive deeper into your local communities via even down to the zip code. If you really want to understand what's happening, I'd encourage you to take advantage and use that data. That is being updated daily as we move forward through this.
Thanks, Mike. And it's so important for our community to know that we have a strong and robust 211 system, and where would we be without it in this COVID-19 crisis? And I also know you've been sharing with all of us about the needs for that system and how 211, the call centers, and then the capacity needs to be ramped up as demand increases. So we thank you for joining today and sharing this important resource for us. Part of the beauty of our sector is that we talk a lot about nonprofits. We talk about my members who are all working to advance philanthropy and support nonprofits and other organizations during this crisis. But we also have a shared common need and resource, and that is human capital and volunteerism. And we're really fortunate Ginna, that you're able to join us today as the lead for volunteerism in our state. And I want to turn it over to you and let us understand how you're seeing this whole crisis unfold from a human capital perspective.
Thank you, Kyle. The one thing that I wanted us to think about too with volunteerism is volunteers, as we all know, when we are engaged as volunteers, it provides us hope. And you have heard and seen the governor call us out to be able to stand up and to see what we all can do. And there is a site that has been presented in the COVID-19 site that you can see. And when you go to that site, you'll see all the different avenues and ways that people can help, as far as if they want to be a medical volunteer, public health volunteer, community volunteer, older adults, and a variety of other ways. But I wanted to talk about one thing I know that's on our mind of how have people stood up and what does that look like? One of the things that is on our mind is the personal protection equipment. It continues to be an issue. Many of you know the issue there is trying to get the shipments in. And so the one thing I want us to think about with that is right now, what do we do to be able to support, in addition to our hospitals and healthcare systems, which are critical, but those other organizations and nonprofits that are continuing to do the work, and this is also going to be important to them. And so supporting them if they're in the nursing care facilities, independent physicians, the homeless shelters, the first responders, and the food banks. The three areas that we're looking at when we think of need right now is we're looking at it from the personal protection equipment and health area. We're looking at food. We're also looking at the area of education. The one thing I wanted to drill down a little bit on as far as our volunteers, so you know, at this site in the community volunteer area, we have currently had over 3,300 volunteers who have registered to be part of the Michigan volunteer team. What we did is, it's important to make sure we all think about how can a volunteer be safe themselves in this time, and what they are serving are also safe. And so as a result, only things that are able to do that are what is listed on the site. And so the one area of that is the Food Bank Council had asked us for assistance because of the capacity for them to process and to think through volunteers coming to them. So through that, we are referring volunteers to them. And so as a result, we have over 1,000 volunteers who have chosen to be a part of that effort. The medical volunteers, there's between 200 and 300 volunteers that have stood up in the medical profession to choose to be volunteers. And then the other thing I wanted you to hear, and this is really important, is it's critical for us to be referred to the local communities. The volunteer centers, most in United Ways, are standing up and they're continuing to drive the local efforts to help people know what it means as far as how they can make a difference and to see local needs. So we will continue to do that work. Thank you, Kyle.
Thank you, Ginna. And thank you also to you and the commission and all those who are supporting the great volunteers who are standing on the front lines of this crisis. So we've talked a lot about the nonprofits, the nonprofit capacity, the work of philanthropy and volunteers. I want to talk a little bit now about how we just think about our work as a sector more generally. In these times of crisis, you don't often get an opportunity to take a half step back and reflect and be thoughtful about what it is you're seeing and observing. And you need a thought partner and a data partner oftentimes to help guide your strategy and thinking and even understand the impact of your work. And for that, we have the fortunate blessing of having one of the leading centers on philanthropy at the Johnson Center and at Grand Valley State University. And Teri, hopefully you've heard and been listening and been working with all of those who are on this call and out in the world, frankly, because the Johnson Center is a global enterprise. What are you hearing? How should we be thinking about this work? What from a center on philanthropy are you observing?
Thanks, Kyle. So as we've been talking so far today really about the immediate needs, I think one of the things that as a sector that we need to always keep in mind is that crises always unroll in waves. So we have the sort of immediate response phase, and then we'll move into the intermediate recovery phase and then think about the long-term impacts. And I think we'll talk about some of those a bit later. Some of the things that we're seeing right now as we're still in this crisis response phase are nonprofit leaders who are struggling with when and how to approach funders. So we're seeing the immediate response with funders of various types, both foundations, government, and other private funders, stepping forward to focus on assistance to individuals. as Michael was just talking about, making sure the food pantries are getting stocked, making sure we have volunteers there, as Ginna was talking about, to help provide that direct assistance. But we're also I think we also need to focus on how we do the immediate response to help keep organizations alive. And nonprofit leaders are now struggling with, when do I approach funders? When do I approach my donors about providing support for us as an organization? Is it too soon for an arts organization, for example, to start approaching their funders if they're not on the front lines meeting those immediate individual needs? So I think that's a balance that we have to always be keeping in mind, how we help the immediate individual response and maintaining organizations. One of the things that we're doing at the Johnson Center is providing a support group, a peer network for executive directors, nonprofit leaders who want to share their pain and their ideas with others. And so you can go to our website and learn more about that. All right, thanks, Kyle.
Thanks, Terry. I'm slower on the unmute button, which my family would actually enjoy being more often available to them here at home. We're gonna move to another question, and then just to go around the table again and get folks' insights, and then we're gonna transition to asking the panelists some questions. They are coming in on the question and answer feature. So please keep those questions coming. We will take those up once we do one more round of check-ins with our panelists. So I do want to kind of move now to just, excuse me, we'll do 2 rounds of questions. I just want to move now to one of the really knotty issues that is manifesting itself not only in the COVID-19 crisis, but ones we've been dealing with for some time. And that's really around the equity implications we should all be considering, and what our responses can do to help alleviate inequities and in some cases perpetuate them. So Mike, I'd like to ask you to begin. As you look at the 211 and the data that's coming in across that system, and you consider the input you're getting from United Way's across the state, what are some of the inequities that you're observing?
So as we think about the equity issue from a United Way lens, we really utilize the ALICE report. And there's actually a link to the report if people are interested. But that report was commissioned by local United Ways in Michigan in the partnership with Consumers Energy. And what concerns me as I think about what we're seeing right now and what we will see as we move forward with is that report identifies that 43% of Michigan households before the virus could not afford basic needs, 43%. And 29% of that group was working and still struggling. So then we take that challenge that we're seeing for families and then multiply that. Now we have those families that have no income coming in potentially, or they're waiting for income to come in, and creates a real hardship. And at the same time, we have families and households falling into ALICE now. In most cases, the ALICE population has no savings. They just don't have the resources. So the needs are only going to grow as we think about that. And then I look in the lens at a local community and talking with United Ways who are on the ground, working with individuals, families, businesses, nonprofits. The challenge we have, especially in our small business sector, is many of the people employed by small business are ALICE. And even think about our nonprofit sector. A good portion of our nonprofit sector fall in ALICE. So we have real challenges ahead of us, but we're going to have to think creatively on how we address these issues from a long-term mindset.
Thanks, Mike. And knowing how the ALICE population was affected before this and now how it's going to grow is a really important thing for all of us to keep in mind. Ginna, I want to move to you for a moment and just talk to us about what are you seeing with regard to the demand for volunteers and the work that they're doing?
Sure.
And what are some of the equity issues that are at play?
Right. Thank you, Kyle. What I wanted to talk about a little bit, I said earlier, when we think of some of the needs that are critical, and we talked about health, obviously, and PPE, but also we've talked about food. And I think it's a good example for us to think about some basic needs. So it's not a surprise to any of you on the phone that the nonprofits right now are having to rethink as far as how work is done and how do we respond in this time. We also have to rethink how we identify needs and how do we think about how people can access those services. So in that critical basic need of food, we all have had to reimagine that distribution model. There are a lot more, as we know, home delivered meals. This is not typically what some of our food banks have been having to do. There's been a distribution of our food service supply that actually has been disrupted. That is on the national level and on the state level. And I wanted you, and I'm sure many of you have been hearing this, but it's not that there is not food, but we have to rethink how we access that food. So with COVID-19, we truly are seeing that the system is being taxed. We have to think about how we operate and how we do it together. I know some of you would like to know what those numbers are. And when I asked for those, what I was told is, well, we have to understand that right now there's a lot of waivers that have to be put in place, even by the USDA, because the most important thing is to ensure that food is being distributed. And so we do not have that hard data right now, but I can give you some general statistics. So at this point in that food distribution, they feel that they've more than doubled the amount of poundage of food that they have had to be able to put out in communities. Some anecdotal stories bring the picture to mind. The Greater Lansing Food Bank recently had 500 cars lined up in the rain to receive food. This is not something they typically see. Gleaners has had to stand up an additional 66 additional mobile food sites. And this is all done with the work of you and the nonprofits and be able to rethink how we do that. There's a lot of, we have to set it up for safety, as I referred to earlier, for volunteers. So that has been done, as you know, with a drive-by distribution so that it reduces the amount of contact as far as for both those we're serving and for our volunteers. But I want to just wrap up before we think of this, that there is a role for government in this, and there is a role for philanthropy. How do we do this in partnership is the question. Government can assist and needs to assist with the procurement of food, and we have to work in partnership. And in government, we will recognize, and we are recognizing, that the work of that distribution process is the best practice models already there. The food banks know how to do this. The communities know how to do this. We have to lift up those models and think of ways to support it. So for us in government, we need to make sure that we provide resources, make sure that food is accessed and procurement is there. But then in addition, the role of philanthropy, as I said earlier, this is a time for us to be innovative. And so when I asked this question of those in the field, what they said is, we need help of philanthropy to think creatively. How do we work with restaurants and farmers markets in a brand new way than we've ever done before? How do we identify different resources of how to bring food into the resources, but also how do we help identify those that typically have not been receiving services? How are they able to access this food to ensure that true equity exists? And so it's not just funds, and they said funds, yes, are needed, but leadership is needed as well. Thank you.
Thank you, Ginna. Teri, I want to just pivot to you a little bit to talk to us about maybe some of the populations and some of the trends that are being, some of the populations that are being affected and some of the trends that you're seeing.
Sure, thanks, Kyle. There's a link that I think we'll be sharing with you shortly to a great website put up by Embrace Race that is collecting some of these resources in a really easily accessible way. But I want to talk about 3 different areas where we're seeing significant disparities pop up. One is the actual direct health impacts of the virus, the safety of certain populations, and then the economic impacts, and where we're seeing disparities along there. We're seeing just significant disparities in how different populations are being impacted directly by the infection, by the virus. So for example, 14% of Michigan's population is Black, but they make up 41% of the deaths. that was just reported in today's New York Times, the update on that. And that's a pattern that we're seeing across the country in different metropolitan areas. Chicago, 32% of their population is Black, but they represent 67% of the deaths. So we're seeing these as being the long-term consequences of underlying disparities in health, access to health care, education, all those underlying structural inequities are being highlighted and exacerbated in the face of the coronavirus. In terms of safety, we're seeing some reports of African-American males in particular being concerned about putting on bandanas or using homemade masks as they go out in public. So much of the violence against African-American men gets exacerbated when there's this issue of, the gangs, the violence, the stereotypical view that many people have, and they're afraid to go out in public with their faces covered. So CNN actually had a great report on that recently. We're also seeing Asian Americans being targeted, particularly as we hear public officials referring to it as the Chinese virus. In the first 2 weeks, of having a website open for this, the Asian Pacific Policy and Planning Council logged more than 1,100 incidents of violence against Asian Americans, ranging from verbal harassment to shunning to physical assault to being barred from access to public transportation, to buildings, etc. In terms of safety, when we look at the possible longer term economic impacts, and again, we'll talk about this again in a bit, but in the immediate time that we're in with the work from home, communities of color generally, employees of color generally are working in jobs that have less opportunity for working from home. So that in 2017, the Bureau of Labor Statistics did some analysis of this. We found that while 32% of Asians, 26% of whites were working in jobs that had opportunities to work from home, only 18% of Blacks and 13% of Hispanics had these kinds of options. So as we're looking at what happens over the next couple of months as the work from home, stay-at-home orders are in effect, we're going to see some immediate disparate impacts on income for various populations. And then I finally just want to add, Native American communities are being particularly hard hit by this. About half of Native Americans live on reservations in the western part of the country in particular. And we're seeing, we don't have good data yet, but we're hearing stories about, the Washington Post has done some reporting on this, lack of access to CDC funds, lack of access, as we're all experiencing, to protective equipment. And given the underlying high rates of some of the diseases that we know exacerbate the impacts of the virus, we are expecting that we're going to see some pretty significant mortality in Native American communities. So we have some Native American leaders talking about this could lead to the extinction of some of our tribes. So grave concerns there. So I just want to encourage everybody, as you're thinking about how you're allocating your time, your resources, to make sure that you're keeping in mind what those disparate impacts are and thinking about how you can support some of the populations that are most vulnerable.
Thank you, Teri. You know, all of us have been meeting on a regular basis, and we've all been talking about this. And one of the things I think we've all identified as we've met on a regular basis is that the spread of this disease is not going to discriminate, but our response strategies could. And just keeping an eye on these biases is a really important one. Donna, I want to come back to you and have you talk a little bit about the equity lens that the Michigan Nonprofit Association is applying right now in the midst of this crisis.
Yeah, thank you so much, Kyle. I'm just listening to all of you, my colleagues, just speaking about all the data and just the importance of seeing this through an equity lens. It's been extremely important, and it's something that Michigan Nonprofit Association thinks about all the time. In fact, you know, it's interesting, as you opened, Kyle, you mentioned how, you know, some of these things are existing, but they're just exacerbated. And so, I mean, in terms of the infrastructure, around technology not being made accessible to the urban areas and the rural areas. That's always existed. But now when we find ourselves in this time of being, having to be remote and having remote access as nonprofits, it just becomes very, very, very challenging. So one of the things I really wanted to share with the group and the audience in particular is that there's two things. One, this group that is presenting before you, and we've been meeting for years, not just around COVID-19, but one of the things that could be easily considered a trap for intermediaries is that we could provide you with data and great insight around what's happening from a macro level. But as it relates to COVID-19, and what I'm really proud of around my colleagues here, is that we decidedly said, yes, we have the opportunity to amass a lot of information from nonprofits such as Michigan Nonprofit Association and the like. But what we do know is that there are communities right now that have been experiencing crisis well before COVID-19, and that there are solutions and innovations that occur at that level. So what we're wanting to do at Michigan Nonprofit Association and with this particular group that we've been working in is trying to make certain that we get that information from the community up so that the solutions that we come up with collectively in terms of helping to create a stronger infrastructure is not based on the old tactics that we've done for lots of years, but is really centered around how can we do things differently. One of the sobering things for me has been being a former banker, and then now I'm working here and leading in Michigan Nonprofit Association, and just having recently a webinar where we talked about the Paychecks Protection Program. And we provided a lot of detailed information to a lot of nonprofits, both small and large. And the idea is that we wanted to provide them with information to make certain that they had a successful application submission, because many of them were really concerned about how can they keep their staff, and more importantly, how can they continue to provide services in communities. And these are communities just like the ones that were described by my colleagues just moments ago. And what was interesting, at the end of that, we took a poll of who's interested in applying for this, and 68%, nearly 70% said, yes, we're interested in that. The challenge, though, is while they're interested in that and probably will put an application together and certainly will help them with that, there's a disconnect between the lenders and the community organizations in trying to get that through. There's inequities as it relates to the thought about what does it mean for a nonprofit as compared to a small business applying for the same type of money, same type of application. And how do we work through that when we know that our communities desperately need both? And the choice points that lenders are making, I think their desire is to be able to help all, but we're finding that there's this group of nonprofits, large group of nonprofits who are not able to get access to these funds in the same way. And so we are working desperately with lenders, and I want to say this is that they are willing and want to work with nonprofit organizations, and they recognize that they can partner with us to do this. But the idea is that we have to be advocates to be able to make that happen. And those relationships are slowly but surely strengthening so we can help communities. But the idea right now, time is of the essence. And how do we be able to help organizations that are small or communities that are in desperate need, that have been living in crisis all along and are now devastated by COVID-19? How do we help be able to streamline the resources that are needed at this moment in time? So just want to say to this group publicly, I'm so happy to be working with each one of you, because I know that you deeply care about community and you recognize the solutions are at the community level, and wanting to be able to assert those at a larger level to be able to create opportunities and structures that can help.
Thanks, Donna. And I know we're still getting some questions in the Q&A, so please keep those coming. We're going to prompt our guest with one more question, and then we're going to take the broader audience questions. So I'm going to, Teri, you're going to be first up here as we think about this, because your work is really geared around helping our community think midterm, long-term, strategically. What is the data telling us? What are what are the frameworks, what are the strategies we should be thinking about? So help us understand from your standpoint, what do you see as the issues coming up, midterm, long-term, that communities and nonprofits will be facing in the midst of this crisis?
Thanks, Kyle. So, well, I've been actually looking for a synonym for unprecedented, because everybody keeps using that word, but there really isn't a good one. We're in really uncharted territory with this current situation. But we do know some things from previous crises that have roiled through our world. The recession being the most recent example, but multiple other crises, Katrina, earthquakes, etc. So we know some things that that are likely to happen. We are likely to see significant attrition in the sector over the next 6 months or so. Both individuals who decide that this is the time to make an exit from their work in the sector, and organizations, smaller nonprofits that can't make it through this. We've been talking about the impact on various fundraising events, campaigns, and we know that not every nonprofit is going to make it through this. So we need to be ready to think about, how do we help get people back into the nonprofit workforce? We're looking at some online training programs, some opportunities to help develop competency-based education programs so that we can help get people back into the workforce quickly. We also need to look at nonprofits as organizations. How do we make sure that we don't lose critical service providers? So one of the things that has often happened in past crises is that it's organizations led by people of color, or organizations that are serving communities of color, that are the most vulnerable when we look at how the economic consequences play out after a crisis, an immediate crisis. So we may need to look at things like, how can we support new nonprofits to emerge over the next year or so as we start the recovery process? How can we support existing nonprofits? Are there ways we can support mergers? And again, lots of issues around needing to work with boards and community leaders to support that, but making sure that we have some of those supports in place. We're also looking at, can we look at ways that 990 data, some analysis of the existing data we have on nonprofits, can help us flag nonprofits that are at risk for sustainability. Jeff Williams, who recently joined us to direct our community data and research lab, has just downloaded the whole 990 data set in the last couple of weeks, and is in the midst of looking at some analysis about how much cash flow nonprofits have on hand, looking at their short-term cash, and as well as the employment rates. So we're seeing nonprofits having maybe a month's worth of cash on hand, and some of the least cash rich have some of the largest numbers of employees. So that's going to create kind of in the intermediate term, a huge unemployment problem in the sector. So I'm going to stay tuned. We'll be sharing some more of that analysis as it's completed. But again, I guess the overall takeaway is that, we have the immediate crisis with individuals and organizations, but then we need to start looking at, during a recovery phase, how do we help people re-enter the workforce, and how do we help organizations use all the tools at their disposal to move into recovery and make sure that we're continuing to offer services to those most vulnerable communities.
Thanks, Teri. Donna, how are you thinking about the midterm, long-term, as you're leading M&A and the work that you're doing with your nearly 1,000 members across Michigan?
Yeah, thank you, Kyle. It's interesting. We've been getting lots of information from nonprofit organizations and those that lead them. But I think one thing that's often forgotten about through this process, as we think about the midterm and long term, are the boards of these organizations. And in some cases, there's going to be a keen level of financial insight and oversight that they have to provide. In some cases, they may have to look at salary expense as being one of the largest expenses that a nonprofit may have, and decided that they may not be able to keep staff on. That might be a temporary decision, but that leaves the board members leading these organizations and making strategic decisions that maybe they didn't count on making or necessarily have the expertise in doing so. And so thinking about a board's role through this process is something that I've been thinking about, my team's been thinking about in terms of what are the supports that we need to provide there. And Teri, you mentioned around the attrition, and that's something else, thinking about the dissolution. So if you as a board member, if the board is actually making that decision that the organization can no longer be sustained. So thinking about how to do that with dignity, how to do that with grace. And there is a way to do that. There's a proper way to do that. And the proper way is looking at the assets and making sure that they're transferred over and they're preserved and kept to be able to make sure that the community's needs are still being met. And I think that's the most critical thing is that oftentimes, which mergers and acquisition and strategic alliances and collaboratives are all good opportunities and options. And it's sometimes dissolution is a great option, but the reality of it is that I think there needs to be a mindset shift here. I think oftentimes when we think about losing nonprofit organizations, we tend to think about it's the survival of the fittest, the biggest, the strongest, the ones that are more apt to be able to continue their organization in a sustainable way, which are all necessary things that we talk about even at M&A around how to run your organization properly and effectively. But the reality of it is, based on the resources of maybe some smaller organizations, and Teri lifted up those also being organizations that are led by people of color or are serving communities of color. Oftentimes, the smaller organizations have just the right effectiveness that are really meeting the needs of the community, yet they're not necessarily connected to the resources. And so I think in long term, we need to shift our mindset from the survival of the fittest and shift it to the community's needs as being the primary directive for us in terms of how we respond in the future. And by doing that, there may be the idea of lifting up these nonprofit organizations that are not necessarily connected to the mainstream philanthropy, but are doing a great job and maybe need to be bolstered during this time and beyond because they're actually really doing good work. So really being thoughtful about this is what I am essentially saying, that this is an opportunity for us to really think differently and really think deeply around how we can keep communities whole. And it may not look the same as it is today, and it may be something very different than we even imagined.
Thank you, Donna. Mike, again, through that whole system of United Ways, how are you thinking about this in the short term and the long term?
I just want to reinforce what Donna said. I know that our United Ways themselves and their partners that they're working with across the state, the challenges that they face short term and long term. But I really reinforce what Donna said is I think we have to, as we work through this, is that we identify what are those core critical services in our community that have to be there, and not focus on the agency, but focus on the service. And because as Donna had mentioned, we have a number of small partner agencies in our community that are doing phenomenal work with at-risk populations that nobody else is touching. So how do we make sure that the core services are there? At the same time, what we're seeing nonprofits are struggling with is, how do I budget for this unknown? None of us have ever experienced anything like this. In trying to create a budget to be able to manage and move forward is very difficult. In many cases, many of our nonprofits don't have the reserves to do that. And it came up earlier around questions of, do we fundraise now? Absolutely, you need to connect with people, corporations, foundations, whatever stakeholders you can to raise those resources for the critical services that you provide. But I think we have a number of challenges ahead of us from a financial standpoint that we're going to have to be very thoughtful, very strategic in how we work with stakeholders to help us continue the impactful work that's happening.
Thanks, Mike. One of the things that comes up CMF and supporting our members, many of which are on the phone, is just to think about in an industry where you're about patient capital, how do you address urgent needs? So some of the things that we're kind of tracking that folks can find on our website. We have a COVID-19 Resource Central. We're sort of sharing what funders are doing and how they're thinking about this work. Many of them are providing flexibility to grantees and looking at converting project grants to general operating grants, removing deadlines for reporting, asking many of their grantees if there is funding in their queue, if they would like to reallocate those funds in light of COVID-19. We have a number of our members who have signed on to the Council on Foundations COVID-19 pledge, where they've pledged to provide more support and flexibility to many of the nonprofits here in Michigan that many of our members fund. We've seen 31, I think is the latest number that we're tracking, pooled funds that are targeted towards urgent response with COVID-19. Many of those are with or through local United Ways. We're seeing also a lot of our members going back and engaging with their donors and those who are holding donor advised funds to ask them if there's a way that they see their work and their investments leading into some of the more urgent needs. And then longer term, we're seeing some of our members think about the interim steps. When we were first talking about this pipeline of federal funding that might be available to nonprofits, there was a clear gap between the fall off on contributions and events and all those things that are supporting nonprofit business models and cash flow needs. So we have members who are standing up temporary loan funds that are provided for short-term capital to nonprofits as they try to find other capital, including the federal loan funds, also as they try to transition their business models. So I think there's a lot of right now intermediate steps that are to be taking. And then long term, I think many are having the conversation that Mike, you and Donna reference, which is what is the new environment when the infection rates drop and the death toll tends to drop, and we have gotten a better handle on managing the pandemic, because the economy turnaround will probably not be as rapid, and none of us knows the timeline for this. So many are trying to talk about what does it mean to keep a ecosystem together? What does the new nonprofit sector look like? We've gotten a number of questions in the Q&A line around this, and I'll answer some of those when we get to that part, which is coming up in a few minutes. I'm going to transition now, Ginna, for you to kind of take on, what are you thinking about from a human capital leadership organization, that both the short and the midterm, and the long-term thinking that you all are handling right now?
Thanks, Kyle. So this group, we were on a call recently, and it was with a foundation, and he said something that made me stop and think. And one of those was that one of the things we're all going to have to recognize is this challenge is so immense that it will not and cannot be solved alone with our foundations and philanthropy and our corporate. We're going to have to also look at government. And I pause a little bit on that because you have to know, those of you that know me understand and know that my base of who I am is I was a teacher, standing up after school programming, higher education administration, and a community advocate in every way I could. So when I came to this role in government, I have this other lens of thinking and knowing that even in disasters, we say that they tend to start and the response is starting with volunteers and ending with volunteers and our nonprofits and the locals that know best what need to be done. But I want us to also think about is we need that, and that has to be there, but we also have to see if there's any way we do not leave any dollar on the table. What do we have the ability to look to government, and are the resources there, and how do we pull those together? And that's one of those pieces that we talked about, and one I'm going to put on the table too is about national service and also volunteerism. looking at volunteerism in virtual volunteering right now and skills-based volunteering. I know many of you are thinking about that already as well. But in addition, I want to move to the thought of what can we do in a new way, and how do we rethink even our national service and what that can bring to us, and how do we retool it? There are a couple different opportunities right now. State commissions, we as a consortium, there are a variety of things we're trying to do to support national service now, to support what they will do now and in the future. But also there's two things I just wanted to bring to your attention. One of the things we've asked, and these are asks, but it's a way for us to retool and rethink how we may need to make sure those asks are there where it's appropriate and where maybe resources can come to us. And the first is, we would like to, and we've been asking, to be able to have state commissions have direct program authority to be able to immediately deploy AmeriCorps members to single placement. And that can be in rural food pantries, it can be in call centers or hospitals, it can be anywhere that are needed. Nonprofits, instead of having the capacity that a program sometimes lacks to be able to have for a nonprofit to stand that up, communities need these resources, so we're asking for those resources to be deployed. There's another thing for you to know is that in the 2009 Serve America Act, it did establish that there's a nonprofit capacity building fund, NCBF. And the CNC statute says that we can grant to intermediary organizations to support organizational development assistance to small and mid-sized nonprofits, particularly those that are facing resource hardships and challenges. So we as state commissions believe this is exactly where we're at right now. So we've also been asking for that. We don't know if we'll be successful, but we've been asking for $1 billion to be able to provide direct cash resources to our nation's nonprofit infrastructure and be able to allocate the nonprofit capacity building fund to state commissions on a formula basis so that we can make grants to intermediary nonprofit organizations to serve and support nonprofit grantees. Because we think that with that, they can provide critically needed financial resources to nonprofits that are facing the resource hardships that will be next as we face the next step after COVID-19. So we're looking to see whatever we can do. And so my point of that is, I've heard from some of you also that you're looking at this as far as we need to think, how do we make sure we do not leave any resource on the table? That's for individuals and not leaving it, and that's for all of you and your organizational structures and what we need for our communities. So we're here, and as a state commission, the Michigan Community Service Commission, to work with you in partnership, and we appreciate all the leadership that you've demonstrated.
Thank you, Ginna. I'm going to begin to sort of get us into the Q&A space. We have several questions that have come in that I'm going to have us begin to answer. But before we do that, I just want Teri to talk a little bit about some of the data collection that the Johnson Center is going to be thinking about in this space, and then we're going to get to question and answer in the audience.
Okay, thanks, Kyle. One of the things that gives, I think, all of us hope in this really difficult time is that we know that about the resilience and creativity that we have in the sector. And we're hearing about all sorts of innovations, from really creative scheduling of volunteer hours, figuring out ways to do our work without person-to-person contact, creative reuse of dollars, all those sorts of things. That the flexibility that funders are now showing in how to use previously committed grant dollars. So we think there are some opportunities both to help to promote sharing of ideas among peers around some of the innovations that are occurring spontaneously, as well as to identify what some of these short-term innovations that should probably become part of our new normal once we get through the immediate crisis. As Donna noted, I think this is a great time for us to rebuild a new normal that's more aligned with our values and the needs of our communities. So we have set up a survey that we're asking. It's a very short survey, just some contact information, and then a space for you to enter any innovations that you're seeing, both with either innovations that you've implemented, innovations you've seen with other nonprofits or with funders, and just do a quick description there. We'll be curating this and be able to try to give you some feedback to this group within the next couple of weeks on some of the innovations that we're seeing, hopefully even faster than that. And then in the long term, we'd like to maybe do some case studies about how some of these innovations got implemented and use that to kind of foster some of the longer term institutionalization of some of the more successful innovations. So you're going to see that link in the chat box, and then we'll be sending, CMF will be sending out links to this webinar recording and the slides along with a link with the link to the survey, but it's in the chat box right now. So again, the idea is for us to be able to gather and share innovations, both for the short-term peer learning and then for the longer-term impact on the sector. So would ask everybody on the call to go to that link and share some of the innovations that you're seeing. And then there's also a space for you to raise any concerns. You know, what are you most concerned about right now, so that we can also share that and maybe make some links between innovations and concerns.
Thanks, Teri. And I think I'll speak for you here. You can correct me later. But
I can't kick you under the table right now, so you're good.
You're right. You'll be grateful for some of the folks who are on this webinar represent networks. And so I would assume too that you'd encourage them to share them not only with their own organization and filling out for themselves, but if they have networks of organizations, to share them with those networks as well.
Absolutely. Thanks for highlighting that.
Thank you. So we have some questions, and I'm going to do my best to sort of channel them. The presenters all here are able to see the questions, but I'm just going to play traffic cop for a moment. And as we begin to answer these, we'll each take a turn on different subject matter, but if we don't end up answering your question to the fullest, please feel free to submit another question. So I'm just going to jump into the couple funder questions, and I'll leave it to any of the panelists, and I'll answer at the end. But there was a couple of questions about what is happening in the corporate community, and perhaps maybe Mike, this is a 211 and a United Way system that you might want to just talk a little bit about some of the corporate engagement through the United Way system.
Sure. We are fortunate to have so many corporate partners in our state that are committed to supporting our local communities. And United Ways have been partnering, as well as community foundations and other key stakeholders are coming together to create resources to support the work that's happening. The majority of the United Ways across the state of Michigan have created COVID-19 funds. And in many cases, our corporate partners are helping support that work, or also even leveraging that dollars. So our commitment is those resources are being invested right back into the community to help those partner organizations and ultimately to help those individuals and families that are in need. It's a resource in your local community. We're fortunate to have such commitment from those partners.
Great. And it's always dangerous to call out any, because you're going to miss some, but maybe a bipartisan way of going about this. I know our two larger utilities are both providing support. I think Consumers Energy provided large grants to United Ways and to food banks to fortify them as they were getting ready for food distribution. There's a large matching fund that I think was recently posted by DTE Energy Foundation. So I think there's a lot also that corporates are doing to just try to put out resources in quick response to COVID-19. I also know that some of our corporate and foundation members are taking their own matching programs and ramping up the matching levels, moving from a 1-to-1 or 3-to-1 to a 5-to-1 matching program that allows their staff and their trustees and others to provide support to nonprofits. There's a couple other questions that came up dealing with specific issue areas and the advocacy work that's being done There was, and I'll leave this open up to anyone on the panel to answer, but there was a series of questions about some of the chronic issues that are showing up more intensely now, some about foreclosures and mortgage forgiveness and commercial property owners who might think about forgiving their rent to their tenants, and for commercial lenders as well. Anyone want to talk about some of the response strategies we're seeing for commercial interest and some of the essential needs around housing and some of those areas?
This is Donna. I don't necessarily have a specific example to share about what's actually happening, but I can tell you what organizations are deeply working in those particular realms, and that's the Michigan League for Public Policy and CDAM, both Gilda Jacobs and Luke Forrest, as well as the Association of Action Agencies too. They're working on those specific items right now, and so those might be great resources to be able to provide you with more understanding about what some of those specific strategies are around that. So I just wanted to offer that.
Thanks, Donna. And Mike, I didn't know if you wanted to touch maybe through the 211 system, what you're seeing in those areas?
Yeah, right now, obviously, that's one of the growing requests that's coming out. And I see that this is only going to multiply over the next few months around rent and utility assistance. We've had many individuals forego payments for rent over the past month, which is wonderful. But the reality is it's going to hit and it's going to grow in need. So I know that United Ways and many partners are coming to the table to determine what's the best approach to address this issue, and trying to identify resources, mobilize resources, partner with state orgs to identify how we can address this. But it's going to be an increasing need in the near future.
Thanks, Mike. Ginna, I think this might be a question for you. As we're thinking about volunteers who are standing on the front lines, and the organizations that are placing them and supporting them, the volunteer agencies that are relying on these volunteers are often social service agencies. And they may be concerned about the liability to clients or liability to the volunteers. Just wondering if there's been any discussion at the statewide level about volunteer liability. These are issues that National Service and the volunteers that you support face every day, but it seems to be more acute now with the pandemic. Any thoughts that you might have?
Good point, and I saw that question and it made me think I would like to explore it more deeper than the answer that I'm going to provide, is because those of you that are doing it, we obviously it's not just saying, are you safe? And it's actually being very specific as far as if, for example, I'm in my 60s, so I'm not a person right now should be on the front line. So when we look at that age group, when we look at challenges, when we think of making sure that we're continuously asking individuals and supporting them to be able to be there, and to be ensuring that if they at any time have any issue, that it's all of our civic duty to step away and to not be there if in fact we have an issue at home or for ourselves. With that said, that's just this element that we're all doing. What I think the question is asking, and I want to explore that a little bit more as far as where those liability pieces are, because obviously that is not my background as far as legal, but yet I think it's really important in an answer that the field is asking for. So if I could, Kyle, I'd like to explore that more, and then we can get information out of what we find.
Great, thank you. Going back to an earlier question around assistance and for housing and so forth, we do have a number of members, and this came through our Q&A line, who are providing emergency assistance for the COVID-19 crisis, but also they're providing, thinking of providing more intermediate funding for housing assistance. But the question is when to knowing the limitations of philanthropy, when to expend those funds, and try to be more strategic about when that assistance might come into play. I know that, just to come back to you, Mike, just one more time, if you don't mind, as we're thinking about the 211 data, where does housing and rent assistance rank just sort of generally in the feedback that you're getting, so that folks can kind of know what the timing might be for their own investments?
So as far as top needs, rent payment assistance is number 2 currently, and it's also the top unmet need. So because of those, it's increasing and actually even homeless motel vouchers are being an issue as well as far as unmet needs. So I think utilizing that data to help inform how we take the limited resources we have to get that into partner agencies who are working directly to provide assistance, community action agencies, Salvation Armies, are a number of organizations that are partnering in communities to address that. But I think utilizing 211 data to really inform where we're at with that, and then to determine how do we put resources in there to help families that are in need.
Thanks. I'm going to just pivot just for a moment here, if we can, and just talk, Donna, there are a couple questions that came in around nonprofit capacity needs. This is really a game changer for many, thinking about what an ecosystem looks like. How are you, and I know you're doing some work in Southeast Michigan statewide, how are you working with the nonprofit capacity builders, and what should this group know about that work?
Yes, so we have a capacity building network that actually covers all of the counties in Michigan to provide services to communities that are able to really get very specific in terms of what those communities need, which is really helpful. And with this network, M&A has been working with them for many years, providing them with resources and tools. And then conversely, or in addition, rather, they bring back, community knowledge that we need that really helps to inform the work that we do. So at this time, what we're looking at, and this is a bit premature because we're still kind of in the ideation mode, more developed as we think about Southeastern Michigan. But when what we're thinking about is how do we help nonprofit organizations go through what we consider 4 phases of this impact of the COVID-19 pandemic. And so where we find ourselves are looking at resources that are more, right at this moment, more of the response and relief, if you will. And so we've been making certain that we're available to provide resources to nonprofits at any time they're calling or anytime they're sending emails. We want to make sure that we're providing that information and making it readily available to them. The relief part right now, and I think this has been the part that has been the most urgent, is around getting those resources to make certain that they can keep their staffs employed. And that comes through the PPP and providing opportunities and resources to make certain that they can really have strong applications and applications that can go to lenders who would actually accept their applications. And as you can imagine, there's a lot of work that's there. But then when we're thinking about the recovery and after we can go on the other side of this, really thinking about how can we provide resources to nonprofits to be able to help to recover through this. And that's a myriad of things, whether it's expert, not just advice, but support that they need from an accounting or HR or legal, whatever it might be, to really be able to put things back in order for them. And we think that's going to take a considerable amount of time. And working with the Capacity Building Center network that we have, that will be our best opportunity to really drill down in communities and give the support that they need. And then lastly, thinking about the reform that's needed, because again, no one knows what it's going to be after this. We know that we're going to be forever changed, and how we do our work is going to be different. But we also know that there's some simple things and some things we should be thinking about right now as it relates to reform, so that if anything happens like this again in the future, that we are prepared and have the policies and the processes in place. Because there's, we had a lot of just reaction to what's happening. but we want to make certain that leveraging the capacity building networks, that we have that knowledge that provides us with the opportunity to advocate on behalf of the sector around some things here in the state, and then also federally, that can be helpful to keep our nonprofit sector strong.
Thank you. Donna, you and I might pair up on this next one.
Sure.
In full disclosure, Donna and her board appointed me to be chair of the policy committee, and so we share this work. So there's a couple questions about the advocacy, Donna, that's going on at the national level that we should probably talk about. I'll start out, and you can finish up if you don't mind, because I know you're work too, with your chair role at the National Council of Nonprofits.
Right.
The question is, what's sort of the advocacy that's going on to provide support to nonprofits through COVID version 3.5, 4, 5, 6, and going forward? And I know specifically there is the SOS Act that was introduced last week. Our own Congresswoman Slotkin is co-sponsoring, that is looking at raising the cap on the size of organizations eligible for the federal loans. I think there's also earmarked funding for support directly to frontline nonprofit organizations. I know, Donna, you and Tim Delaney at the National Council are working on advocacy issues for the sector. Do you want to spend some time helping this audience understand the work that you're doing there?
Sure. So you mentioned around making sure that one of the big pieces I can tell you, and this has been something that our members have been sharing here in Michigan, but it's been across the state, is while the programming has been exceptional as it relates to organizations that are 500 employees and less, there are many that are organizations doing really impactful work that have over 500 employees. And so really making certain that this next go round, as we look at a second round of stimulus funding, that is actually included. And so I want to just back up a little bit to say, with this last stimulus package, what was interesting for us is that we fought really hard to make sure that just the word nonprofit was actually in the legislation, which was a great win for us. I mean, that was like, wow, that's awesome that we have nonprofits in there. Obviously, the downside for it was that there wasn't this understanding around how could a loan program like what SBA has out available for small businesses, how that would translate to nonprofits. And so really getting that tightened up for possibly a next go round of funding is something also that we're looking at. And we feel like that is truly important, especially as there are so many more small businesses to the tune of 30 million, and then thinking about the universe of nonprofits, which is 1.5 million. So really making sure that we are advocating for equity as it relates to these packages of funding that's going out has been our primary focus.
Thank you. And I do know that the independent sector is advocating for a sign-on letter in support of the SOS Act. In that, you'll also find a significant increase in the cap on the above line charitable deduction, as well as other provisions that I think are important to the sector that also aligns with our mutual public policy agenda. There's a series of questions related to, I think, a broader topic, which I'll leave open to any and all of us to talk about. And that is that in thinking about all of the work that we do, all the work that we're advocating for in the communities we serve, social isolation is particularly difficult for communities of members of our community who are persons with disabilities. In particular, social isolation policies make them, doubly vulnerable. Is there any discussion about the various supports that need to be available to persons with disabilities? I do know that for a number of us who are supporting nonprofits in this space, the biggest challenge is trying to figure out how to not only provide them the support they need to remain open and deliver services, but how to think carefully about not creating greater health risks with the volunteers who might be helpful to their lives and to them on a day-to-day basis. I do also know that there was some questions about whether or not these materials would be available to persons with disabilities, and we'll try to make, and also available in multiple language. We'll try to make sure that we are conscious of the inclusion principles that we need to adopt during this. So don't have a specific answer on whether the materials are going to be available either in the PPP program or in this webinar, but we'll make sure we try to make sure that they are accessible.
Kyle, I just want to just say I really appreciate that question being brought forward, and that's something that I know at M&A we're continuing to think through, but I would lift up Encompass Michigan, that's led by Todd Culver, as an organization that might be able to provide some deeper insight and resources as it relates to the impact of COVID-19 with people that are living with disabilities.
Thanks. Just because you were the last to speak, I'll round another question that I think you and I need to probably answer together.
Okay.
Only because we both run nonprofit associations, associations that serve other nonprofits.
Mm-hmm.
So the question is M&A offering, and I'll put CMF in here as well,
Mm-hmm.
membership or access to resources at this critical time? So
Yeah.
I know. Speaking for CMF, we've made sure that our COVID-19 response page and the things that we're curating there are open source. We'll try also to make sure that people can get access to the information on what our funders members are doing, so that the resources that are available to nonprofit are readily accessible. Donna, I'm going to turn over to you to talk a little bit about the open source work that M&A does as well.
Right. Thank you so much. And I really appreciate that question as well. I mean, I think it's important, and it's been our philosophy to make all of the information related to COVID-19, all the resources that we can curate, that we make it available for every nonprofit organization. So that was something that we really wanted to make certain that was available. So it's on our website, by the way, and there's lots of detailed information that ranges from providing guidance and advice on a myriad of issues, from mental health for your own colleagues to HR decisions you might need to make, to the PPP that we've been talking about a lot during this call. So it was important to make certain that was available. As it relates to moving forward through this pandemic, and I mentioned earlier around trying to put together a system of support that includes the capacity building centers. We will be thinking about what that support looks like. If it looks like that there is something around a membership, that might be something to consider. But I think what's most important right now is making certain that we keep the nonprofit sector as a whole strong and providing a system of support that does that. And that's what our focus really is on. And that's why we've made those items available. And they're, again, on our website, prominently on our website. So you can access them easily, and also downloadable things that you can keep and share throughout your own networks as well.
Great. Teri, I'm going to turn it to you to kind of talk about your research. And I know you had perhaps comments on some of the other previous questions. And then we're going to do closing comments because, believe it or not, we're near the end of our time together. So Teri?
Okay, great. So I'm just going to comment on some of the resources that we have. We do a lot of workshops and training for both foundation professionals and for nonprofits. And we are, like many of you, in the process of doing some triage, but we will be planning some of our workshops to be open for everybody. We know, for example, there's going to be a lot of need for support on fundraising. So you kind of stay tuned. We'll be looking at making more of our resources free that way, and as low cost as we possibly can. We also have a financial analysis course that we offer for grant makers, and we are actually in the midst of revising that. That one's going to be offered online in May. The dates will be out soon. And one of the things we're going to be incorporating into that is how do you look at a nonprofit grantee's financials, taking into account what's happening right now, and help identify opportunities for capacity building for nonprofits. Thanks for checking in on that.
Yep, thanks, sir. And so one of the things I know is that I have to be conscious of time. We didn't get to everyone's questions, but we'll try to make sure in follow-up that we provide you answers to some of the questions. I know there were very specific ones about resources and links to things that we talked about. We'll make sure we get to those. Some were existential, like what does the new normal look like? I think that was beyond my scope on this call, but we'll all try to live that answer together. On the screen, you'll be able to see the web address for each of our organization's websites here in a moment. And we'll be standing up events, publications, tools, samples, updates on our advocacy work, and a lot more. We encourage you to visit and let us know, each of us individually, or if not collectively, if there's any content that we can help you find or resources that we can provide you to support your work. Thank you for participating in your thoughtful questions. Thank you, Teri, Mike, Ginna, and Donna for taking the time out today to be with us. We would really appreciate you filling out the very short program survey you'll be receiving with the links to this webinar's recording. Please share it with your networks. If you'd like to see our networks come together again, please let us know. Was this a helpful conversation? Are there things and subjects that you would like to see us talk about in the future? Share your ideas and topics with us, and we'd love to be able to share those with you in the future. Also want to thank the crew at the Council of Michigan Foundations and the Michigan Nonprofit Association, the Michigan Association of United Ways, the Johnson Center, and the Michigan Community Service Commission for supporting this webinar and the content that's on it. Thank you to your volunteers and all your trustees for supporting you in this work. And for all of you, thank you for the things that you do every day. We're here to support you. We are the infrastructure organizations that lift up your work. That's our job. We are delighted to do that and look forward to doing that to you in the future. We look forward to seeing you in face-to-face opportunities in the future. But for now, stay separate, stay safe, have a great holiday weekend for those of you that are celebrating, and be well. Thanks so much.